Hello, and welcome to this Beyond Clean virtual conference. The speakers for today's conference, the sponsors for today's conference, and the Beyond Clean team are all so excited that you're here. If this is your first time joining us for a Beyond Clean virtual event, I want to call your attention to a couple of event functions. All of the windows on your event screen are movable. You can shrink them, you can enlarge them, you can move them, whatever you need to do to create the event feel that works best for you. In the upper right corner is a resources tool. Download conference sponsor information and the resources and links that your speakers have provided for you, as well as instructions for obtaining your CE certificate for the day's event. On the bottom left, you will see a Q&A or question and answer tool. Any questions that you have for the speaker during each session can be submitted to them using this feature. Our speakers today will bring you a wealth of knowledge, and all of their information can be found in the speaker bio tool on the right side of your screen. Along the bottom are the icons for each of the windows as well. Clicking these will minimize and maximize each window. This will be an action-packed conference, and there will be 15-minute breaks between each of the sessions. So feel free to grab a snack, check on the dogs or the kids, assemble a tray, do some jumping jacks, whatever you need to do before joining us again. All right, good morning, everyone. We are so glad you're here today, and without further ado, I'd like to turn it over to our first speaker, Dr. James Stobinski.
All right. Thanks, Lindsay, and welcome. Good morning. Thank you for attending my presentation. My name's Jim Stobinski. I'm your first speaker, and my presentation is Education is Changing. So let's get started. And Lindsay?
Yes.
I need a little bit of help. I am not seeing the main screen.
Okay, if you actually pull up the, the live view.
Yes, got it. Thank you.
You're welcome. Good morning.
Good morning. Okay, so I am broadcasting to you from my home in Denver, Colorado, and it's 6 o'clock in the morning here. I know it's 8 o'clock in the East Coast, but Lindsay's got me oriented, so we're ready to go. All right, so our presentation is Education is Changing. How will you respond? We're going to talk about, I'm going to mention a number of times ambulatory surgery and how things are changing. So we will get to that in a minute. Number one, this is me. I'm Jim Stobinski. I am the CEO of CCI. For the nurses, you may know me. I have done a number of presentations here with Beyond Clean in this series. But if you hold the CNOR, CSSM credentials, or you've heard of the CNAMB credential, that's what we do. I'm the CEO. I'm also a college professor. I teach graduate students, doctoral candidates at a couple universities. That's all in my bio. So disclaimer, our company, CCI, we're a nonprofit, but we do certification. We're accredited. We're going to speak to that briefly in a few slides here, but I do have to show you this disclaimer. I don't need to read it to you, but I do need to tell you there's no special advantage to listening to CCI speakers. We do certification. You don't get extra credit on your certification exam, and I will talk about certification. So we need to just show you that it's an accreditation requirement. These are objectives. So I'm going to talk to you about surgical care, education, how that relates to our competency and what we do in surgery. I'm going to talk about a number of things that affect the education that we do to stay current in healthcare. And I'll talk about a number of things, but hopefully you can take at least one away from you. I'm going to talk about disruption and how we do education. And then I want to talk to you about the term apprenticeship. All right, that's a lot of material. And Lindsay tells me that we have a hard stop at an hour. So I'm going to be very attuned to that. So we are in the middle of a very unsettling time in American healthcare. With this whole pandemic thing, if you're working in ambulatory surgery, the feedback that we get from a lot of our nurses is it's been incredibly disruptive. We've had ambulatory surgery centers that have just curtailed operations during this pandemic. State regulation, just the nature of business, people not wanting to have surgery in the middle of a health emergency. So it's been incredibly disruptive. However, we've had all of these rough seas, surgical volume is down, all of this going on, changes in insurance status. This has been quite a time. However, all of these rough seas that we're enduring right now, that's layered on top of all the change that's going on in surgery. Even if we did not have a pandemic going on, there's a whole bunch of things happening. So there's considerable change underway in surgery. There are plenty of speakers on the topic of, everything that's going on with the pandemic. So I am not going to concentrate there. I am going to stick to changes that were underway in surgery before the pandemic even came to us. So I attended the OR Today live conference. They actually did that live. It was here in Denver. And my good friend Bev Kirshner talked to me and said there are major changes coming in how CMS reimburses surgical care. When we boil this all down, the term is site-neutral payments. For those of you working in the ambulatory setting, you know that for a long time, ambulatory surgery centers have been at a bit of a disadvantage. So the reimbursement has not been favorable for ambulatory settings. So we are doing now some of the same cases that we do in a hospital setting. An example, total joints. We're doing those same cases, but the reimbursement is not as favorable in the ambulatory setting. So CMS is contemplating a change in the payment systems, proposed rules, and what they're saying is site-neutral payments. So whether you're working in an ambulatory setting, in a hospital setting, if you're doing the same procedure, you're getting good results, you're going to get the same payment. If this all goes through and gets through the comment period as she gets enacted, this will be tremendous change for the ambulatory surgery setting. So there's a lot going on in surgery. This one has potential to have tremendous impact. So the proof of how much is going on in the ambulatory setting, the nature of ambulatory surgery, here's the proof. So accreditation agencies, entities that are involved in this, we are making a transition to the ambulatory setting, paying more attention and focusing more effort there. For the Certification Board for Sterile Processing, they have recently developed a credential that's specific to the ambulatory setting. For CCI, my company, we have a new credential. We are beta testing right now to develop an exam that's devoted to ambulatory care. And also BASC, they have a certified ambulatory infection preventionist. And Lindsay informed me just before we started, so you will be able to get credit for this presentation. For the materials that you'll see today, you'll be able to get credit for that for your CAIP preventionist certification. So the certification entities, CMS, the people that do the reimbursement for surgical care, we are aware of the shift to the ambulatory setting, and it's getting more and more attention. So let's talk about some big trends in surgical care and the effect in the ambulatory setting. The next few slides, these come to us from the American Hospital Association. It's called their chart book, their trend book. So if you have a web-enabled device, go to the AHA chart book, and you can get two references like this. So the big overall trends affecting American healthcare, you can find them in this chart book. So let's distill this down. The number of hospitals in the United States is going down. And so this chart shows this 11 or 12-year period from 95 to 2016. This is the most current information that's available in the chart book. We are losing 2 to 3 dozen hospitals every year in the United States. And this is coming especially true. It's especially hitting rural areas. So the days of any city of any size having their own hospital, and they had a wide range of services, they did surgery, delivered babies, they had inpatient hospital beds, those days, that situation is rapidly changing. The very first slide that I showed you, let me see if I can take my slider back and check this technology. So the other thing is the whole line about what we call a hospital, that too is changing. And Lindsay, I'm trying to get back to slide number 4, and it shows push to audience. Is that image going to show up here in a moment? Yes. So this is a scene very close to my home. I live in a suburb of Denver, Colorado. This is the Sisters of Charity of Leavenworth. This is a micro hospital. So we're used to dividing things up and saying we have hospitals, we have health systems, we have ambulatory surgery centers. We now have things that are actually in the middle of that. So this facility is close to my home. You're looking at the whole facility. So they have a couple of operating rooms in there, some procedure rooms. They offer a diversity of services and even have some inpatient beds, but it's very limited service. And their big thing is they provide emergency care. This is a transition to ambulatory care. We will see fewer hospitals. They're going to be larger and more concentrated in urban centers. But then you can have things like micro hospitals, ambulatory care centers, ambulatory surgery centers that are going to be in different locations to provide care. So let's return to the bulk of the slides. Lindsay, I got to tell you, I'm liking this technology here. I find it easy to use. So the number of hospitals are going down. The number of Medicare certified ambulatory surgery centers, these are the facilities going to be affected by that site neutral patient payment system for our patients. The number of surgery centers is going up. So I showed you the chart. Number of hospitals is going down. The number of surgery centers is going up. So if we look, this chart covers a period from 2010 to 2016. By my count, just a quick computation, that's 427 more ambulatory surgery centers that can receive payment from Medicare, Medicaid sources. That's roughly an 8% jump in about 6 years. So there are big changes happening in surgery. And then we have things like this. So what I showed you before, those are industry sources. American Hospital Association, this is just a business source. This is Business Wire. These are things that are easily available in a quick internet search, and they project that the number of outpatient surgical procedures, our market in ambulatory surgery, is going to rise rapidly. It's expected to grow from 129 million procedures in 18 in 5 years. It's going to go up to 144 million procedures. So business people know this. Industry sources know this in healthcare. We are transitioning to more and more ambulatory care. I have used this slide. It comes from the AHA chart book. And this is the percentage. This is not the overall number of surgeries. This is to break down the ratio between inpatient surgeries and outpatient surgeries. So if you were to put a trend line on this, you will see that the percentage of all surgery that we do, the percentage is trending to more and more outpatient surgery. Now, this chart doesn't tell us where the surgery is done, just that it was done as an outpatient. So in theory, it could be same-day surgery in the hospital setting, but the point is more and more cases, more complex cases, are now being delivered in some sort of ambulatory setting, and increasingly ambulatory surgery centers. And then we have articles like this. So this is the widely respected literature, peer-reviewed literature. These are the sorts of things that surgeons, healthcare administrators, this is what they read. This is the Journal of Arthroplasty, a very well-respected medical surgical journal. The bottom line here is that the outcomes in ambulatory surgery settings for doing things like total joints are good, as good or better than what you can achieve in an inpatient setting. So people like the Centers for Medicare and Medicaid Services, CMS, they know this literature. That's what drives us to things like site-neutral payment. They're realizing the advantages of ambulatory care. And I will also tell you, let's go back, at the end of this or in the features that Lindsay described to you, I will gladly share these slides. If any of this is helpful, you want to borrow some of these slides, we'll gladly do that. You can contact me. My contact information is there, and I will gladly share. Just acknowledge the slides where you got them. That'll be great. So let's talk about ambulatory surgery and how this affects things like certification, licensure, regulation. What does this all mean? If we're changing where we do surgery, how we do surgery, how does this play out and come to affect things like certification, the laws that govern healthcare? How does this all come together? So to break it down for you, when we talk about education, certification, licensure for nurses, it comes down to a very simple thing: more choices in smaller chunks. So there's a number of stakeholders involved here. CCI is a big one for nursing in the operating room, but basically we're paying attention, we're making adjustments, and there are essentially more choices in education and certification, more choices, and we're breaking it into smaller increments. So if you work in sterile processing, and I'm concentrating mainly here on sterile processing technicians and nurses that work in the operating room. This too applies to ambulatory to surgical techs and their certifications, but I'm concentrating mainly on sterile processing and nursing. So there are a number of certification bodies in that work with the healthcare professions in the operating room. So these are some of the groups that are involved. And on the right, on my right, these are the credentials that are offered by CCI. So when I began work with CCI about 9-10 years ago, we only had 2 credentials. We had CNOR and CRNFA. That was it. Now, 10 years later, these are all the credentials we have. CNSCP, that is for advanced practice nurses who work in the operating room. We have a management credential, CSSM, still have CNOR, about 41,000 nurses worldwide hold it. And as I told you earlier, we have a new credential that we're testing right now. It's concentrated in ambulatory surgery, CNAMB, Certified Ambulatory Surgery Nurse, and soon we will have a new credential. You heard it here first, CPNF. This will come before CNOR and CNAMB. This is for nurses very early in their career. So we're now offering a lot more credentials. We're paying attention to our stakeholders and their needs. In this shift to different settings for surgery, we're paying attention. And if you're in sterile processing, they're paying attention too. So these are all the credentials that are available to you from ISHM and CB-SPD. You will also, you have more choices than the nurses have. You have a choice of 2 organizations and a wide diversity of credentials. And I will point out the management credential from CB-SPD covers 3 roles: supervisor, manager, and management roles. So back to the theme, more choices, smaller chunks. You get more choices in your certification because we're paying attention to how surgery is changing. So there are some bright spots in the middle of all this change and all this disruption. There's some bright spots. The public and healthcare consumers, they're gaining a better appreciation for the work of healthcare workers. If you see videos of people going into work at the hospital in places like New York City, which was hit so hard during the pandemic, and there are people leaning out of their windows, cheering, clapping, and yelling encouragement, that is a great thing. Many people are finally figuring out the importance of central processing technicians and the work that you do and how important that is to safe surgical care. Things like Beyond Clean, they are possible because of all the resources now going to support central processing. And in some areas, with all this rapid pace of change, we've been able to quickly adjust. Our education efforts are one example. So learning is changing too. And all of us that are involved in this, we have some choices. Well, we must learn to stay current, why we must learn it, and how we will learn. All of this is changing rapidly. And for those of us that are in healthcare, a stakeholder, you're involved in certification, you have choices to make. So trends in education, as healthcare becomes more complex, education levels must go higher. And that applies to all of us. Surgical techs, central processing, the nurses, anesthesia techs, it hits all of us. The need for lifelong learning is clear. Staying with the same level of education is just not going to suffice anymore. The stakeholders and providers of education, they're changing too. There are new players in the mix, and there are some disruptors in the marketplace. For those of you who have web-enabled devices, I'm going to give you some things to look up. I'm going to pause for just a moment, and I want to ask you a question. So in the chat, here's the question. For those of you who are attending, if you are certified, reply, send in a message, and just say yes or no if you're certified. And for us, certification does not include things like BLS or ACLS for the nurses. These are things like CNOR, CPAN, CAPA. For the surgical or for the central processing, you have a wide range of credentials. If you are certified, put yes or no, and then the credentials that you hold. All right. So the disruptors in the marketplace. If you have a web-enabled device, you can search Google, Coursera, and certificates and see what comes up. These are the disruptors in the marketplace. They are changing what we're learning and how we are learning. The common ingredient, all of these providers, Google figures into this. The other four providers, they offer educational content. Much of it is free, and it doesn't necessarily lead to a college degree. Here's the big disruption. Google has just said they're starting a system of career certificates, job-ready skills, a pathway to jobs, in-demand, high-paying jobs, salaries, $50,000 to $80,000. They are not asking you to go back to college. They are asking you to earn a certificate for things that they need, job skills that Google needs, and they're partnering with Coursera. So not a college, not a community college, not a trade school, Coursera. Go to Coursera, earn these certificates, and Google has a job for you. Learn the latest skills, get ready for a career, earn a certificate, complete this course, and you become employable. It's called upskilling. There are parallels here, and there are things we can use here in the operating room. What does this look like? The certificates take about 6 months to complete. No previous experience required. They're developed by the employer, Google. Grants and scholarships are available and is hosted on Coursera. This is a brief description of one of the jobs, and the starting salary is $66,000. If you're being forced to make a career change, this is a viable option. So let's make a comparison. In nursing, our path used to be very clear. It's a very straight, clear, linear path. You would have your pre-licensure education, an associate degree, a BSN, and then you would enter the workforce. If you didn't have a BSN already, they would encourage you, give you tuition assistance. You would earn that, especially if you went into management. And then you could just plot this all out. Eventually go on, get an MSN, an MBA, and your path was very clear. Now that's changing. And there's issues. This is a picture of a college, a university in Germany. But this whole linear path that I lined out before for you for nurses, when you get disruptors in the marketplace and there's a period of rapid change, we have to rethink this whole thing about the traditional university path. In fact, there's changes going on in the workforce right now. So let's talk about those. This is a picture, I think, from the 1920s. This is surgery 100 years ago being done on a military, I think a Navy hospital ship. But there are big changes going on from over the last couple decades, but momentous change from what we were doing 100 years ago. The registered nursing workforce, we're changing rapidly. There are about 3.8 million RNs that hold a license in the United States. I believe 3.8 million also includes LPNs, LVNs. So about 3.8 million people that we would call nurses. About 3 million of those are actually actively working. So 10 years ago, a report came out. It was called the IOM Report on the Future of Nursing, the Institute of Medicine, and they made a recommendation that we should up our education levels. That prompted a bunch of schools to begin developing BSN completion programs. So this is an example of how quickly education paths can change. So currently, we have 140,000 nurses that pass the NCLEX, the entrance exam, to come into the profession of nursing every year. About 70,000 of those, these are the numbers to the right of the chart in the little table. About 70,000 associate degree nurses pass the NCLEX, join the workforce every year. In addition to that, about 72.5 thousand nurses complete their BSN and enter the workforce and pass the NCLEX. But in addition to that, 66,000 nurses every year are completing RN to BSN completion programs. They had an associate degree, they had a diploma, they went back to school. So the net effect here, they completed that BSN education program. We are adding between the BSN grads and the RN to BSN grads, 139,000 BSN grads are going into that pool of registered nurses. So the amount of BSN and higher educated nurses that we have is going up rapidly. So in 2017, that number was 64%. So we're changing the makeup of the nursing workforce quickly in response to all the change going on in American healthcare. We're changing rapidly. We don't have a real good picture of the perioperative nurses, but from our interaction with the certified ones, they too are going back to school, and we're seeing more and more BSNs. So great information on RNs. What about central processing? So I have a historical picture for you also. This is a picture of a portable sterilizer from the year 1916. And this is what they used to take out to the battlefield, and they would sterilize uniforms in this sterilizer. And they did that because of lice infestation. So again, a historical photo for central processing. These are the people 104 years ago that were operating the sterilizer. So changes too for central processing. There are more and more courses available to you if you want to be a central processing technician. Diverse educational offerings. At one time, many people, if they went into central processing, they just learned on the job. That is changing. OJT is a part of this on the job training, but increasingly a diversity of certificate courses, diploma programs, college credit programs, for-profit, not-for-profit providers. And some of these programs now will connect you to an associate degree. We're just beginning to see this, but the point is, this is a reaction. The market reacts to the needs, and the education needs for central processing for nurses is additional education, higher levels of education, and the market is reacting to that. So, but still, there's a little bit of an issue because for certification, they don't spell out the training course that you need, and they don't specify that you need an associate degree. It's the same thing in nursing. We do not specify a certain degree, only that you have a valid license. So if anybody has better information for me, put that into the chat box. But right now, I don't see ISHM or the certification board requiring a specific educational course to earn their credentials. But you have new information, put that in the chat box. So the point, as far as education, we have a variety of paths that we can take. Whether you're a nurse, you're a surgical tech, an anesthesia tech, central processing, we have a lot more choices. And one very important word is now in the conversation when we talk about education, regulation, licensing, certification, one big word, competency. So if you've attended my previous presentations, you know that I return to some themes all the time. This is important these days in certification. When you talk about recertification, what's the basis for your credentials? And to be clear, the accreditation agencies that tell us how we can set up our credentials, those are the same for ISHM, the Certification Board for Sterile Processing, for AST. We are all accredited by someone, and many of us use NCCA. We do as nurses, and other entities too. So the importance of competency in our programs, that's the same for all of us because we're using the same accreditation entities. So let me stress the definition of competency. That is your actual performance in a situation. So when we talk about learning new skills, shifting to the ambulatory setting, we have to learn new things. We have to develop competency. Your actual performance in a situation, that's what's important, not the fact that you have just the book knowledge and you completed a class. Can you actually do the work? Another part of this connection when we talk about certification regulation, continuous professional development. This definition comes to us from the Board for Nursing and Midwifery in Ireland, but it applies to all of us. Continuous professional development is part of certification and recertification. This encompasses experience, activities, processes that contribute to your development. This is a process of lifelong, structured, and informal learning. Accrediting bodies, licensing bodies, regulatory entities, they are placing more emphasis on competency and the quality of your recertification process. Whether you're a central processing technician or nurse, the processes are the same. So, issues that are common for us in sterile processing and also for RNs. There is no central authority for education and training. Competency assessment, we're paying more attention, but right now it's not an integral part. We could do better on how we bring people in our profession and strengthening the education that's available to them. Standardization is lacking, and that's common across all of our programs. And for perioperative nursing, for sterile processing, not the case for surgical techs, but it is for sterile processing and perioperative nurses. There's no final exam that says you possess competency and you're ready to work. A lot of this falls to the employer. So this idea about how do people get qualified to be in the workforce, this is not a new issue. And there's actually a connection here to the American auto industry. And let me cite an example. You're looking at Jeeps. If you know anything about Toledo, Ohio, near where I grew up, Jeeps are important in Toledo. This is a picture of the old Willys Jeep factory. And that is actually the way that they drove the Jeeps. They stored them on the roof of the factory. You're probably thinking, what is Jim driving at here? Why are we talking about Jeeps? Because there's a connection to how we bring people into the profession. It's called apprenticeships. That's what I want to talk to you about. These days, people think this applies to just electricians, carpenters, welders. Doesn't. So this is a picture of an automobile factory. This is an old factory around the turn of the last century, 1908, 1910. So that factory that you saw in the first slide, that's my father used to work. This is the old Jeep plant, which is about the age of this picture when that was the age that Jeep plant was built. My father was a millwright. After World War II, they needed to upskill rapidly. The economy was booming. It was a period of big change. They needed people like my father. He was a millwright welder. He repaired machinery in the Jeep plant. He got his job through an apprenticeship. So we've tried to deal with this in nursing. How do you bring people into the profession to make sure they have competency? This is Patricia Benner. She's a nursing theorist. She wrote a book called Educating Nurses, The Need for Radical Transformation. Patricia Benner said, if you want to become proficient to possess competency in any job, whether you're a surgical tech, central processing technician, you have to master 3 things. So she used the term the 3 apprenticeships. This area of intellectual training, what do people have to know to come into the profession? We can do better here. And we have to learn the hands-on skills. How do you put a load into the decontamination unit? How do you inspect instruments? These are hands-on skills. So this whole dilemma about how do we bring people in, how do we make sure that they possess competency, this comes from the Department of Labor. We could use apprenticeships to address this. And this is the definition from the United States government of an apprenticeship. Yesterday, when I was driving to work, there was a public service announcement about prompting industry from the Department of Labor to develop apprenticeship programs. We could do this. An apprenticeship is a paid job combined with education. This is run by an employer, and you earn a credential. We are already doing this when we bring people in to sterile processing, to perioperative nursing. We already do many of these things. We just don't call it an apprenticeship. And one of the key ingredients that is missing are the credentials. So I'm going to speak to you about that. These are all the people, including healthcare, that are now doing some sort of apprenticeship for all these different jobs. This is a Department of Labor site. You could actually go into this and see the apprenticeship that's being done in healthcare, construction, advanced manufacturing. This is the United States government prompting us to do this. So I think there's an opportunity for the operating room to develop apprenticeships for things like perioperative nursing or developing skills that are needed for the very different work of ambulatory surgery. So the education that we need and how we're going to deliver it, how we're going to connect all the stakeholders, all of this is changing. So an example, I said earlier, smaller chunks. Let's talk about a smaller chunk in another opportunity. This is something that CCI is doing right now. These are micro credentials, smaller chunks of knowledge and learning. This is what we're doing right now. This is a part of the material that's covered on the CSSM credential. It's strategic management. Micro credentials are web-based, portable. We are changing how you learn. They demonstrate competency, not just book knowledge, but you can actually do work in strategic management. That's how we set this up. It is connected to certification, but it is not the typical credential like CNOR that we know now, but we can document your learning and we recognize your achievement. This is a form of continuous professional development you can engage in over the span of a career. Micro-credentials are another disruptive force in education. They bridge a skills gap, skills and knowledge that were not present in your original training that brought you into the operating room. They're relevant, industry-specific skills. They link to competency. If this sounds like what Google is doing with those certificates, you're correct. It's another approach to drive you to achieve the same thing. And there's a very strong link to the demonstration of competency that you can actually do the work. Just like the Google certificates, they're straightforward, they're quick, they're efficient. And beyond clean, there's a connection. CCI is working right now in partnership with a variety of partners. You will see soon, at the end of 20, the beginning of 21, we are working with a number of partners to develop these micro credentials. So if you want very targeted learning in a very specific area, we're developing that. We're beginning work right now. In 2021, you will see micro credentials similar to strategic management, multidisciplinary, surgical techs, central processing technicians, nurses, healthcare administrators. If you want a micro credential in a very specific area that deals with sterilization, decon, central supply, we will offer that in conjunction with Beyond Clean. And you will see those available in 2021. These are not limited to nurses, and these will be done in partnership. And you will see more and more of these developed with some very familiar names in surgery. CCI is developing them. This will be documentation of your expertise that you actually possess competency. You can do work in this field, and we address your knowledge, skills, and attitude, not that you just pass the test, you can actually do the work. So documentation, it's very important. It's big in education. How do you document this? This too is changing. CCI is now partnering with an organization called Credly. So for our new credentials, these micro credentials, they'll be documented with a digital badge. So these will be available for anybody that earns a micro credential. You're going to get a certificate. You know, the very familiar certificates, diplomas that I showed you earlier, you will get those. But in addition, you're going to get a digital badge. The advantage here, these are cloud-based. So a disruptive force, Google is doing certificates that are entirely online. This documentation, you could print it out. It exists entirely online. So when you complete this course with CCI and Beyond Clean, you will get a digital badge. It is a symbol, an icon that you can put on your LinkedIn account. You can tell people about it on Facebook. The difference being this is a data-rich supply. We can actually go over the course content and put it into this file, which is based in the cloud. So what you covered, explaining what the micro-credential is, who sponsored it, what you learned, how we tested you, all of this. If you choose to share your badge, you could, let's say you're searching for employment or you want to demonstrate to HR that you're keeping your skills up, you can share your digital badge. If you choose to share and you make it available, they will be able to see all this information. And let's say that you're searching for employment. This badge is a two-way flow of communication if you allow it. So in theory, an employer in another city could access through LinkedIn or some other social media site and say, I'm looking for people who have competency in this process. They can do this in sterile processing, and they can send you information that they are seeking new employees with this competency that you possess. And if you wish, you can have this information sent to you. You can open the flow of communication. That's what you get with the digital badge, which is a means to document education. As we do more education to react to the nature of changes in surgery, this is one way we can document it. So it goes far, far beyond a certificate of training. So this is just about the end of my slides. Let me leave you with this. Education is changing. You have choices to make. How are you going to react to that? I'm sure there are going to be people who say, this is just too much. I can't take this. It's too much change. They're near the end of their career. We're seeing this a fair amount in perioperative nursing, and they retire their credential and they leave the workforce. That is one choice you can make. I think there's a world of opportunity here in things like digital badges, micro-credentials, apprenticeships, new education courses. If we're going to continue to change the way we do surgery, shift to the ambulatory setting, there's a number of challenges here, but I also think there's a number of opportunities. So let me leave you with this. This is Lee Iacocca, who recently died, but he's a prolific writer and a titan of industry. He did two big things in his career, three big things. He helped to invent the Ford Mustang. He helped to develop the minivan with Dodge Chrysler Plymouth. He was part of those teams. He led those efforts. And he also saved Chrysler when they were going to go bankrupt. Dodge Chrysler, he saved them. He said this about education: apply yourself, get all the education you can, but then, by God, do something. Don't just stand there. Make it happen. Use your education. All right, that concludes my presentation. On my slides, I have a lot of references. Where did I get those images? A lot of references are actually in the presentation. Here's some other sources. This is the thing that I talked to you about, the Trend Watch chart book from AHA and the Future of Nursing report. These are the references. I'll take questions. And this is my contact information. And if anybody does reverse search and they figure out who this image is, I will send you a prize from CCI if you can figure this out. This is another historical image. All right, Lindsay, I'm going to stop talking, get a sip of water. Do we have questions?
We do have a couple of questions. Thank you so much, Jim, for that information. Beyond Clean is certainly honored to partner with CCI on a number of initiatives, including the conference that you're at right now. Put this on in partnership with CCI. And Jim, a lot of the questions that have come through are specific to the micro-credentials that you've been mentioning. So I will get right into it. The first one says, actually, this one is related to certification in general. It says, your slide mentions CBSPD looking into ambulatory care sterilization tech. Do you think ISHM will follow suit?
I believe so. This is a reaction. We're changing where we do surgery. Quite frankly, it is some work to develop a credential, but this is their expertise. If there's a demand for more ambulatory credentials, these organizations will go there. CCI did, Certification Board did. If you'll notice, both the ISHM and the Certification Board offer credential and endoscope processing. That's a current hot topic. If there's a demand for more ambulatory content, I am very confident they'll react to that because it's an opportunity for their business.
All right. Thank you for that. Next question that came through. Are you going to incorporate the micro-credentialing as part of CMS surveys education? That way surveyors would be on the same page of what they're looking for within a facility.
So CCI does not have direct engagement with CMS. I do know the CMS requirements for documenting education. I think that's the opportunity for certification boards in things like digital badges. We can use a digital badge to tell CMS, to give them a flow of information for everything that we covered in a credential. What areas you were tested on, all of that can be shared. I think that's the opportunity. Greater sharing of information to inform CMS. CMS, when they come in, they want to know, do you possess competency and can you do the job, and how is that measured? Digital badges, micro-credentials, and credentials, if we do the documentation well, we can demonstrate all of that. So I think we can meet some of the documentation needs for CMS and to gain CMS deemed status. I think we can help in that, in these education efforts and how we do documentation.
Wonderful. I have two attendees that were quick to the game in offering up a suggestion of who this gentleman is on your slide. Is it Huey Long?
That is correct.
All right. All right.
Are these people from Louisiana? Is that why they know this?
That's a great question. I am not sure. It looks like one may be from Texas. I'm not sure where the other one is from, but Huey Long it is. Congratulations, both of you.
Lindsay, if you send me their names and contact information, I'm going to send them a gift. Thank you.
Okay, will do. Absolutely. All right. Question came through specific to the digital badges. Can someone copy or use your digital badge without your knowledge?
Negative. They are secure. That is one of the best things about them, is the security. The other thing is you can put an expiration date on them. So the person that issues the credential, the entity that issues it, maintains considerable control. Could they do a screen grab of an image and then place it? Yes, but not the function. So that is one of the best things about digital badges, is the security.
All right, very good. I have multiple people asking if they can get a copy of these slides. And as Jim mentioned, if you'd like a copy of the slides, you can feel free to reach out to him. His contact information is in the speaker bio tool on the right-hand side of your page. Jim, it looks like that is all the questions that we have for today. We're about 2 minutes under time, which is wonderful. Thank you so much for sharing your expertise and teeing up the entire virtual conference geared toward ambulatory surgery settings. You can go back to sleep if you'd like. I know it's early there. I just want to remind everyone who is tuned in, each session will automatically transition into the next session. And a reminder is that there is a 15-minute break between each session throughout the conference today. If you do come back to the event page and you see a registration page, if you've already registered, please feel free to click on the already registered link and you can simply enter your email address. We're so glad you're all here, and we will see you all again in about 15 minutes.
All right. Thanks, Lindsay.